So we've got a great suite of courses here. They include emergency nursing, intensive care nursing, cancer and haematology nursing, primary health care nursing, mental health nursing, clinical trials, a Master of Nurse Practitioner. And for people who would rather have a more generic degree, we've got a graduate certificate in clinical nursing and a graduate diploma and masters in advanced nursing practice.
The Master of Intensive Care Nursing will enhance my career prospects by allowing me to apply for registered nurses positions that are a bit more advanced, such as a clinical nurse specialist, nursing educator or a consultant position.
The course allowed me to move from a registered nurse on the ward to a clinical nurse consultant in my area and encouraged me to continue studying and hopefully will be a nurse practitioner soon.
I'm originally from the country, so my long-term career goal is to do my Masters of Nurse Practitioner. This Masters of Emergency Nursing will set me up to do that in the future.
The University of Sydney is ranked 4th internationally for graduate employability, and the Sydney Nursing School is ranked 9th in the world internationally among nursing schools. So it's a wonderful degree to have. It will take you all over the world and of course is very well respected. There's probably never a perfect time to start postgraduate study. We've always got work pressures and things going on in our personal life. But we try and be very flexible in the way we offer our courses.
I work 12-hour shifts. Initially, I was a little bit worried that I was going to have trouble finishing all of the assignments on time, and actually it's been quite easy because a lot of the work is done online and it allows me to study at my own pace.
The lecturers are very supportive, especially when you've got a young family and you need some time. They're very flexible.
You learn a lot in books, but you can learn a lot more face to face. And being able to talk to your peers in the classroom as well is really helpful.
Per unit there's 4 face-to-face study days, which are really helpful actually because you get to ask questions while you're there, and then the rest of it is online.
One of the great things about our postgraduate courses is the calibre of people who teach them. Our lecturers that are employed here full-time are research active and are leaders in their field. We have a number of people in conjoint roles. This means they may have something like a nurse practitioner role in the public health system, but then teach here part-time. So it really means that we maintain that clinical relevance.
Lots of the lecturers who work with us are in intensive care areas within local health districts. Yeah, they help us with everything that we're trying to learn.
The block intensives are great because they are small classes. You get guest lecturers and guest academics, guest advanced practice nurses to come in and talk to you, and that can be really inspiring.
We build your confidence to give really high-level clinical consultancy. We develop your skills in leadership. We spend a lot of time working on systems because we know it's nurses who are not only at the coalface for patients, but are also the people who really impact systems of care within our health system.